Genetics is a science of genes, hereditary, and the variation of organisms. In modern research, genetics provides important tools for the investigation of the function of a particular gene, for example, analysis of genetic interactions. Medical genetics differs from human genetics in that human genetics is a field of scientific research that may or may not apply to medicine, while medical genetics refers to the application of genetics to medical care. Medical genetics specialize in medicine that involves the interaction between genes and health. And another thing about medical genetics, it involves the application of genetics to medical care, including research on the causes and inheritance of genetic disorders and their diagnosis and management. Welcome everybody. I'm Pratima Penumarthy, founder and director of Arya Math Academy online tutoring program. Our academy, in collaboration with Stravio, proudly presents STEM Talks. In this talk show, we will introduce you to fascinating people who very passionately inhabit scientific and technical frontiers of our society. It's with tremendous pleasure that I welcome you all to our 6th episode of Arya Math Academy's STEM Talks. Today's STEM Talk is with physician researcher Dr. Aditi Korlimarla. Dr. Aditi Korlimarla completed her medical school training from India, and she was a resident in training in clinical cardiology. She then pursued her dream to work with children. She's an early career scientist at Duke University, North Carolina, in the Department of Pediatrics. She works as a post-doctoral research associate and a research lead in the Division of Medical Genetics. The focus of Dr. Aditi's work is rare diseases, mainly glycogen storage disorders. Her past projects included clinical research on management strategies for individuals with Down syndrome. The article was recently published and it has received a ton of interest from researchers, clinicians, and educators around the world who care for these individuals. Little bit about Dr. Aditi. Growing up, Dr. Aditi was an epitome of an individual with empathy and had a deep-rooted passion to be a medical doctor. She used the high emotional quotient as a driving force to pursue medicine. Today, with empathy as a strong suit and medical background, she aims to create a lasting impact in the field of medicine. When Aditi is not firing up her neurons to solve medical mysteries or answer tough research questions, she loves to paint, read, bike, write on contemporary issues, and keeps revising her to-do bucket list with her new adventures. So much to learn from Dr. Aditi. Welcome, Dr. Aditi, to our little program.
Hello. Hi. I was really surprised and very happy that you wanted me to talk on your show, Pratima, because I think outreach and teaching these youngsters is so important. We've gone through so much in life. And so with our experiences, hopefully they have lesser tumbling stones on their way.
Thank you so much. That's very, very warm. Very sweet of you to even talk about this, Dr. Aditi. The very first question, which will be a very common question, which most of the people will ask you this, and I know most of the students will be eager to ask you, is why genetics education is so important.
Sure. So basically, genetics involves, a disorder in your chromosomes. And so there are about 6,000 known genetic disorders. And we have treatment only for 600 or 700 of them. So because of the vast difference in the unknown, it's very important to learn about what kind of disorders are treatable and untreatable, and try to focus on betterment of these treatable disorders, because we say treatable, but they only cure the disease. They probably do not even help with quality of life. So there's a lot to learn as researchers in the field of genetics. And I think primarily understanding the basics of genetics would be very important, especially for students pursuing science fields and bio fields specifically.
Absolutely. So Dr. Aditi, what is the What is exactly is medical genetics and genomics?
Yeah, in the introduction, I think you rightly said that, Pratima. It's basically the interaction between genes and the health of a person. So, medical geneticists, as they rightly put it, are medical doctors or PhDs who work on understanding this interaction between genetic factors, predisposing factors that affect the genes, environmental health that affects the genes, and how they correlate with disease progression in an individual or even health of an individual. So basically, these guys are trained to evaluate and diagnose these rare disorders, treatable disorders, and help in deriving management strategies that may help the patients in a much better way. These are all mostly hereditary disorders, right? So there may be a pedigree of patients, their fathers, their forefathers who were affected, but we do not know if they were even diagnosed. So with what medical genetics and genomics does is basically understand the root cause of the problem and try to understand how the disease progression happens, how the natural history of the course runs, and how we can better save these individuals with genetic problems.
Thank you so much. And how do medical researchers use genetics?
Well, research in medical genetics is very vast. We have these, so like I said, you can be an MD who's into medical research in genetics. You can also be a PhD and still do medical research in genetics. So the students who are with the PhD background, they're more into the lab side of things. So they are looking at, the genetic variants, what we typically call mutations. The new terminology is genetic variants now. So they look at genetic variants. There are a number of variants that we do not know about. They are called as variants of unknown significance. So these guys work in the labs to understand how these affect a particular disorder. They also work on preclinical studies. Preclinical studies are studies that are done on animal models. So, for instance, they work on disease-specific mouse models to understand how the mouse reacts to certain treatments, how they, get better with increasing doses, or how their natural progression goes on. So for any research study, basically, we need to back it up with preclinical studies, which are done on these mouse models. For instance, I work on a disorder called Pompe disorder and Pompe disease. And so we have like a Pompe mice model. And so preclinical studies basically involves individuals with a PhD background to study the entire disorder in these mice. And then what we learn from these mice is then translated into clinical studies. And this form of translation is called translational research. And it is what drives the clinical science ahead. And so individuals with MD background, they are more involved in clinical studies, which involves patients, individuals, human beings who are affected by a disorder. So once we do this translational research, we start understanding how the disease basically evolves in an individual, right, as a mouse. And so we bring that lessons and put it on the bench side of things, bench to bedside kind of a thing, And so an MD with a medical background basically works with this information. So they work with the preclinical data, they work with all the clinical information that you can gather from a patient, and they try and advance the science in the human being side of things.
Yes. So, what is exactly an early career scientist? Because I know a lot of undergrads and even grads are a little confused about that. What is it? What is an early career scientist?
Yeah, by definition, it's basically researchers, again, can be background of an MD or with a background of a PhD. They are basically researchers who are aged 30 to 40 years, within 10 to 15 years of obtaining their doctorate degree, working in an academia setting. So working in like a university setting.
Mhm.
Those folks are called early career scientists.
Oh, I see. Because I know this was a question which was also asked by a couple of my undergrad students who are, they may know, but they were literally wanted to get more information about it.
Sure.
Also, Dr. Aditi, did you know that you wanted to be a researcher when you became a doctor?
Frankly, no, I did not. I don't think I ever got the opportunity to work in major research while I was pursuing my medical school. So, as you rightly said, I did my medical schooling from India. And so we're not even taught the basics of medical research out there in medical school. So, during my training as a clinical cardiologist, a senior did approach me to write up a case, but I didn't even know where to begin. So I think it's very important to learn, the basics of medical research while you're doing medical, schooling. It's not taught, but I believe it's very important. Yeah.
Yeah, that's a wonderful point you said. And also, is medical research important for a practicing physician who is not at all involved in the mainstream research?
Yeah. So doctors, I say they are like lifelong students. Like we have to keep updating ourselves with ever-growing clinical practices. Medicine is all about, following guidelines and management strategies that are laid, and it's all evidence-based medicine. Like if a person walks into your clinic and they have some kind of a disorder, no doctor in their right mind would give them anything that they feel like giving. It's all laid out. It's management guidelines and strategies that are laid out based on evidence-based practices. And so the main resource for getting all of this information, other than attending, annual CMEs, which are like conferences, is doing research by your own self, which may be specific to your own field. And so this research basically entails not just looking up articles, but also understanding important updates, analyzing, a clinician's own database to understand how their patients are doing, what treatments work more than the others for a specific group of disorders, looking up these advanced evidence-based management practices. Basically, it's very subspecialty centric, no doubt. Like some of the subspecialties are heavily like research based, and some rely a lot less on research. For instance, medical genetics is a field which is heavily research based. And what do I mean by saying that is a clinician who's practicing in medical genetics has fewer number of clinics and fewer number of patients compared to a general pediatrician. So what do they do in the rest of the time is they are heavily focused on pursuing their research careers. So they are involved heavily on scientific writing and publishing, as well as doing multiple kinds of research with all of the data that they have collected. So a geneticist, like that person is not purely a clinician. They have like multiple roles. They would also be a researcher, and they to run these research, they are like heavily funded through institutions like universities, and also they get funding from industry sponsors like pharma companies for their work to advance the science, the research.
Right, right. It's wonderful. A lot of information you have given you, Dr. Aditi. Also, how did you come across this wonderful opportunity?
Yeah, for me, it was more of luck by chance, I would say. I was volunteering at the Duke Cancer Center while I was preparing for my medical license examinations, what they're called USMLEs, to pursue a residency in the US. And I came across one contact through LinkedIn and with similar credentials as mine. And so I reached out to them and found out about the vacancy. But now I typically, tell the youngsters and, folks who are trying to get into this kind of research is each university has a web page under, it's like a separate web page under each university, which the names can be different, but they're basically catered to postdocs. So postdoctoral services, and so you can find all of these research related information under those. They generally post job postings in those portals, and you can also, if you have like an interest in a specific subspecialty in medicine, you can reach out to their division head or residents doing that particular thing, because there are a lot of opportunities for undergrads to work in subspecialties like this. And even medical students, while they're doing their medical schools, they can take a break for a year and work purely on research. I believe there are a number of universities that do that in the US. So I kind of feel that is very important, even when you become a clinician, to understand, I would say, the research part of, how this evidence-based practice comes into being. So that's one way of reaching out to people and trying to understand opportunities like working in medical research for a little time while you're, in med school or undergrad.
Yeah, this is wonderful point you said, because I know that a lot of kids who just completed their undergrads, in the pre-med track, and they must be, planning to take a break for some years or maybe a year or so. But I think doing this type of clinical research would be very important.
Sure, and it also helps with the resume when they apply for their medical, MCAT. Is that what it's called? After MCAT is when they match into a med school, right? So having these, so when you work as an undergrad, you work with publications. So having that, your name on a publication, on a research article, like puts you on a higher pedestal compared to somebody who does not have a name. So, like if you're like cited, then you have a better chance of, getting into med school. So that's become a thing now. So I would say, like, undergrads who are trying to pursue a medical field should probably, if they're pursuing a break, they could get in touch with somebody in nearby universities and explore this option of medical research.
Absolutely. This is absolutely very much a prime point you have explained now, because I know that most of the students are, trying to jump around and find new opportunities in that break year. So yeah, this can be a very good point for them. Also, this journey that you embarked, Dr. Aditi, upon at Duke, was it an easy one?
Well, at first, I think I was just very happy because I came to the US with a dependent spouse visa, which did not allow me to work. And being a physician, it's hard not to work. And so I think when I embarked upon the journey, I was just happy to, use my medical knowledge. But now I kind of tell women physicians who come to the US on a dependent spouse to definitely come with a student visa, or they should have given their USMLEs and matched into residency programs before they come, because it's not there, it's not like known information. It's hard being a doctor. You're called a foreign medical graduate. It's so when you're an immigrant who's trying to get in, you should have your foot in the right doors before coming to the US, kind of a thing. But now I'm in my fourth year as a postdoc, and I have grown so much. The past 1 year with COVID and, getting the opportunity to work from home, I've learned a lot in this time as to how to be a doctor while pursuing even non-physician jobs. And so I did not know that, that kind of a career pathway even existed. So I'm at a very, peaceful, I would say, mindset now, knowing that I can still use my medical background and probably not pursue a residency, but stay in research and still advance my career. I've learned a lot about physician burnouts, how to, get that work-life balance, how to pursue leadership roles as a physician without having to deal with, liability issues or pressures by, getting sued by patients. So I've learned different career pathways after receiving your, MD, or even if you're like a medical school dropout. I hear that's a big thing in the US because, there are a lot of pressures for medical students who are pursuing their MD. It can be like a lot of debt. It can be like, they're not set in their mindset to, pursue it in further years. And so I would say that there are so many roadways and maps ahead. Like, it's not the end of the world. So they don't teach you all this in medical school in India or in the US. So there are a lot of options for students who are pursuing or who have pursued an MD degree, which are not like, which are called non-physician jobs.
Right, you're very right about it. Yeah.
Yeah.
Also, you mentioned about this COVID, and as you know, when you're talking, I realize that of course the COVID has so many positive points,
Yeah.
in a different way.
Yeah.
So I felt like sitting at home or even with the family, there's so many things that even physicians like you have, you could get more information, how you can really help the community, in what way can you be help in your research, right?
Yeah.
So you did get a lot of the positive things out of the COVID lockdown, which we all had faced. Just
Yes, I
yeah.
agree. I agree. I think there are a lot of positives. We are very fortunate if you've not been affected or if your loved ones have not been affected in a way to mental health issues did happen over COVID, but I think many of us have been fortunate to kind of reflect on all of our choices and how to advance our careers. And, especially being an early career scientist,
Right.
I just thought there was just this one way of looking at things. And I'm happy, like, to learn that there are so many fields that, we don't know about. There's so much growth, there's so much potential in each of those fields.
Absolutely. Now, how
Yeah.
would you say, Dr. Aditi, your journey has been so far?
I think mine has been, I've been fortunate, like I said. I did not want to stumble upon this research. Like, it was never in my mind. But once I dwelled inside the option, I grew to like the research that I do. I grew to take ownership of the research that I do. And I think, as I said, once I learned that, my career doesn't have just this one path and I can like pursue what I love to do, I think it opened up many doors for me. So I have enjoyed it in the past 4 years.
Yeah, I can see that. Also, you said that you learned about how to be a doctor while pursuing non-physician jobs. So that's not something that we generally hear. So is that even possible?
Yeah, that is possible. Yeah. In fact, like I said, I gained a lot of information in the past 1 year. And I've also come to understand that they do not teach you these things in, when you're doing your med school in any part of the country. So any part of the world for that matter. So it's all self-taught, but yes, it is possible to pursue these non-physician jobs, being a physician.
Absolutely. Also, before I ask you a question about, about the career path, I just wanted to know that since we all know that genetic testing, it actually helps find genetic diseases, right? In many kinds of situations. Example of some of the tests that we can find diseases can be like something that runs in a family, maybe found in a child or an adult, maybe found in a baby in the womb or a newborn. So we know that that many kinds of tests are being used for many reasons.
Yeah.
Could you share with us some of the type of testings that you are aware of, or what are some of the practical applications of this genetic thing?
Sure. So, as I said, like with the MD background, I'm not involved in the lab side of things that do all of these biochemical, molecular levels testing, but we do collaborate with them and work very closely with these collaborators who work with laboratory testing. So, it can be, so, okay, let me give you an instance that you have a specific disorder and suppose it's a rare disease, like not very well known in the community, in the world about that disease, and you have an individual with that rare disease, and you've figured out that there is a genetic variant that is abnormal in that individual. But what now? Like, what if there is no treatment for that individual? Or what if there is some insufficient treatment available for that individual? So we have to progress their disease, right? Like we have to monitor the progress of the disease, basically. We run biochemical tests to understand if there are anything called biomarkers in the blood, which can help us understand if the disease, if the treatment is helping them or if the treatment is causing some kind of side effects. And so monitoring this disease progression with the use of biochemical tests are known as biomarkers. And so these are done typically, in 6 months or annually when a child comes to visit us in clinics. We always get these lab works done for the individuals. It can be typically for my studies, which is glycogen storage disorders, it's defects in the liver. And so we typically monitor their liver function, their liver enzymes, something called creatinine phosphokinase, which all affects the basic metabolism in the body, but you can get all those answers through their blood tests. So that is one thing that we do is biochemical testing. Apart from that, there are also a number of genetic tests which are like highly efficient tests so when you look at a chromosome, and when you especially look at genetic disorders, a lot is not known about certain rare disorders. And so there is something called whole genome, whole exome sequencing, where they look at like these tiny bits of your genome to understand if you may have a defect in one certain part, but and it's a known defect. Suppose you have a defect in a certain chromosome, a certain part of that chromosome, but a certain patient is much more severe compared to their peers. So there are these cofactors which are acting as aggravating factors for advancing their disease. So you try and look at other parts of the genome. So that is where whole genome sequencing, next generation sequencing, whole exome sequencing comes into picture. So you try and look at the whole the genome of the individual to find additional defects that are influencing this primary defect.
Wonderful. Also, because this is very much information, which is definitely, I'm pretty sure most of the people have to digest and understand and even do more research about it, to find out.
Yeah.
Could you just throw some light on a few of the career pathways for an MD?
Yeah. So basically, I would say that when you pursue your residency or when you have you're an aspiring MD or you are an MD, you can always work in an academia setting, which I'm doing right now is working with a university. So you have a ton of resources. You can work on your weaknesses. This is like an early career scientist pathway to research. So basically you have mentorship. I've been very fortunate to have a very, good mentor who's more experienced than me, who tries and explains those disorders and gives me opportunities to work on her studies. And you get funding through her being a primary investigator. So that kind of a thing. So you work in an academia to begin with. You can pick how many years you want to work in an academia setting. You can also work lifelong in an academia setting because you have these tenure tracks after that, wherein you become like an assistant professor and a professor where your pay scale is pretty good and you can enjoy work-life balance. It's not very fast-paced. So that is one side of things, is the academia setting as a researcher. The second is working in an industry. So working in industry is basically corporate sector, biopharma companies. It can be big biopharma or startups. It can also be working for federal agencies like the NIH, or you can work as an expert medical witness for legal cases. And you can also work for NGOs that are, run by these patient advocates who work on these rare disorders or genetic disorders, or even generally, you may hear these walks or runs for a cause kind of a thing. They're all run by these patient advocates. And so they work in NGOs, and you can help working in by, by providing your expertise and medical background in these NGOs, by being on their executive board and things like that. Other than that, you can also work in international organizations like WHO. In industry, I would say there are a number of avenues for an MD or even a dropout MD for that matter. So I can like throw some light on some of the names of these positions. So you can work as a medical science liaison. This person is a person who gains all of this literature and knowledge about certain medical conditions and disorders, and they educate other physicians in the areas to basically help the need for drug development. You can also work in as a regulatory personnel, where individuals focus on study design for clinical trials and ethical ways of conducting research. They can work in clinical operations or as a medical manager. It's basically an MD who oversees individuals who work on clinical trials with collaborative efforts from different institutions. So all of the physicians from different universities pool in their clinical database, and they work together. And an MD who can like oversee all of this work in a clinical trial basis is someone who's a medical manager. You can also, like, if you're interested in writing, work as a senior medical writer, a creative writer, or a content developer for these biopharma companies. The list is endless, Pratima. So like most of the senior folks, especially as an MD, you're put into mid-level senior or executive posts in these biopharma companies, where you're either a medical director, a senior medical director, eventually you become a VP. You could also spin off with your own knowledge and start your own gig and become a medical innovator, an entrepreneur. There are a lot of folks, I know physicians who are now into digital healthcare and marketing strategies. That's a thing too. So like I said, they don't teach you all of this, but there are so many career pathways for an MD or an aspiring MD, not just in academia setting, but also in industry.
Absolutely. Very much. So much information. So much. So Dr. Aditi, I know it's a repetitive question talking about your Duke University, but could you please tell our viewers more about the work that you do at the Duke?
Sure. So I mainly work on rare disorders. So basically, a rare disorder is a medical condition that affects a small number of individuals. So it affects like one person in over 2,000 or 10,000 individuals. And so our division at Duke University is a center of excellence for research on glycogen storage disorders. So basically, glycogen storage disorders are a group of disorders where an individual suffering from it, they cannot break down complex sugars that we eat in the form of our diet into simple sugars. That is just like basic sugar that we derive energy from to do our daily activities, to do our exercises, to maintain this normalcy in the body at a biochemical level. So I typically work to collect patient data and information about their clinical parameters. I review medical reviews and records to see what treatment they are on, what kind of diet or exercise they follow, if they have any kind of speech and language difficulties, if they have developmental outcomes that have been affected because of a certain rare disorder, and how they fare in their physical examination. I also collaborate with neuroimaging and neuroscience PhDs and MDs. I collect MRIs of these patients and try to understand. So it's like a syndrome. These, folks suffering from rare disorders, it's like multiple systems in the body are affected. It's not just the brain or not just the liver. It's a multitude of symptoms that's happening. So we try and collaborate with a number of experts in within the division and outside the division, but within Duke University, to try and understand how all of these impact an individual. So with a brilliant team of research coordinators, there are research specialists, there are clinicians of different subspecialties. I work on influencing management strategies for these disorders. So we also, like I said, collaborate with a lot of biopharma companies who give us funding and a number of clinical data as well from their side. And so together with the biopharma companies, we advance the science by drug development and distribution, and how to help these folks with rare disorders, genetic disorders. I also work on mentoring, undergraduates, medical students, and other postdocs within the division. Because I've been here for 3 or 4 years and I've having to experience all of this, I try and teach these undergrads to better in their sciences. And I've been fortunate to have a good mentor, so I use certain soft skills to help out the others who come to work in our division.
Excellent. After hearing so much from you, Dr. Aditi, this is something which I would tell to all the viewers who I know most of them are undergrads or who are planning to pursue their career in medical field. If you are interested in a career in which you always want to learn more in a field that is constantly expanding in ways that advance healthcare and improve the lives of patients, families, and communities. And for all these things, if your answer is yes, then medical genetics and genomics may be the right career for you. So, what do you say, Dr. Aditi, to the younger generation?
I would say yes. I think pursuing a career in medical field itself, you need to be driven with a lot of passion. It's not an easy journey. You have to give up on your social life a lot for a lot number of years also. But it's a lot of like reading and studying. But I would say you get past these years only if you have, enough passion to help out people, to help advance science and use your medical knowledge towards greater good.
Absolutely. In fact, I just wanted to share some of the resources, and correct me, Dr. Aditi, if you have more information too, that some of the online genetics career fairs that actually happens in a couple of states, and it happens during spring and fall of every year. And the goal of these career fairs is basically to attract and inspire a lot of young professionals. It can be medical students, pediatric, medicine interns and residents, undergraduate or graduate genetic students to consider a career, the career in genetics. It's a very promising and expanding area of medicine, but one with, of course, a serious workforce shortage again. So this shortage
Yes.
is compromising the promising benefits that can come from all the research and clinical effort underway in this country and definitely around the world. The little bit information which I gathered is that attendees of all these, those attendees, who come to this type of career fairs, they might have an opportunity to hear from different type of geneticists, a clinician or a general geneticist, a biochemical geneticist, and a research geneticist or laboratory, and in someone like, definitely we have here Dr. Aditi. So these are the wonderful speakers who also come to such career fairs and they talk about them. So I would like to basically end today's the entire interview, first of all, by thanking Dr. Aditi for really taking this wonderful time for sharing with all of us about these interesting different cases you'd explain to us, and your passion for contributing to the science and the development of new theories. Thank you very much, Dr. Aditi.
Thank you so much for having me, Pratima. And if any of your students want to gain more information, I mean, just get in touch with me and probably we can exchange emails and, get their answers, out there responded.
Absolutely, absolutely. Thank you very much for coming forward with that. Also, our episodes, if everyone has watched till date, they mainly focus on various STEM related subjects, which is also like careers, motivations, education, and passions. So, in a simple line, again, I would say just think about us as outlines in science. And please keep on tuning into our show. And if you like us, write a review of STEM Talk on your YouTube channel, on actually on our YouTube channel, which is Arya Math Academy Online. And please don't forget to subscribe and spread the word. So thank you very much.
Thank you.